Here's a common scenario. You go to the doctor, you're not feeling well, maybe it's a sore throat or a lingering cough or a sinus pressure, and you walk out with a prescription for antibiotics. It feels like the right or the responsible thing to do. But do you actually need it? And more importantly, could it do more harm than good? In today's video, I want to walk you through something that is very common but poorly understood: antibiotics. What are they, when they work, when they don't, and how their misuse is quietly causing more damage than we actually realize, including damage to our gut, our immune system, and even our collective future. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends, and subscribe. Let's start with the basics. Antibiotics are medications that are designed to kill bacteria or stop them from multiplying. And they've been one of the greatest breakthroughs in medicine. Before antibiotics, a minor wound infection could become life-threatening. Pneumonia, strep throat, urinary infections, these were dangerous, even fatal. Antibiotics changed all that. But they only work against bacteria, not viruses. And that's a crucial distinction. So let's talk about that. Bacteria are living organisms. They can survive in different environments, even without a host. Some bacteria are harmless, and many are even beneficial, like the ones in our gut that help digest food and support our immunity. But some bacteria can cause infections. So now let's compare them to viruses. Viruses, on the other hand, are not alive in a traditional sense. They can't survive or reproduce on their own. They need to hijack your cells to make copies of themselves. So the common cold, the flu, COVID-19, most sore throats, most sinus infections, these are all caused by viruses. Antibiotics do absolutely nothing for these illnesses, and yet we still prescribe them a lot. Why? Sometimes patients expect them. Sometimes doctors prescribe them just in case. And unfortunately, I know that sometimes it's faster to write a prescription than to explain why you don't need one. And I hope that's not happening anymore. But here's the problem. When antibiotics are used unnecessarily, they not only fail to help, but they contribute to a much larger issue: antibiotic resistance. Antibiotic resistance means that bacteria we're trying to kill learn how to survive. And once they do, they become harder, sometimes impossible to treat. And these are what we call superbugs. They're real, they're dangerous, and they are spreading. Hospitals around the world are now seeing infections that don't respond to any of usual antibiotics, and we're running out of options. And then there is another layer. When you take antibiotics, they don't just target the bacteria that's causing infections. They wipe out your healthy bacteria too. Your microbiome, the trillions of beneficial bacteria in your gut, is collateral damage. That means weakened digestion, poor immune regulation, increased inflammation, and higher risk of conditions like IBS, yeast overgrowth, eczema, and even anxiety or depression. Yes, your gut and brain are deeply connected, and we talk a lot about that on this channel. In fact, the gut-brain connection is one of the pillars of functional medicine. So let's say when I meet a new patient in our functional medicine clinic, I always ask them about their usage of antibiotics, especially in childhood. Why? Because it is likely to have caused some degree of disbalanced gut microbiome at some point, and it may have contributed to a variety of health issues, not necessarily gut-related. For example, your eczema that started in childhood may have been related to the changes in your gut microbiome after you took antibiotics for a common cold. It's not always a direct linear relationship. Usually it's a domino effect where antibiotics could be the instigators. Now, let's talk about when antibiotics are actually appropriate. If you have confirmed with bacterial culture strep throat, then antibiotics can shorten the illness and prevent complications. If you have bacterial pneumonia, or a UTI or a wound infection, antibiotics can be life-saving. Ironically, as a surgeon, I do prescribe a lot of antibiotics, including preoperative prophylaxis for complex surgeries, so I'm definitely not opposed to them. But if you have a viral sore throat, a runny nose, or a lingering cough from cold, antibiotics won't help, and they might hurt. There is sometimes a gray line in terms of diagnosis, as some situations are not straightforward and it's hard to know in the moment what we're dealing with. And that's where testing, clinical judgment, and time come in. In functional medicine, we emphasize precision. You don't treat blindly. You confirm, you understand, and you support the body rather than overpower it when it's not necessary. And sometimes the best treatment is rest, hydration, herbal support, and time. Your body knows how to heal. It just needs the chance. So here's my takeaway. Antibiotics are powerful and often save lives, but they're not harmless. If you truly need them, take them and make sure you finish the full course. But if you don't need them, be willing to wait, to understand what's going on, and to trust your immune system. We'll all play a role in protecting antibiotics for future generations. Overusing them for today's sore throat might mean we won't have them when we really need them tomorrow. Well, if you enjoyed this video, don't forget to like, share, and subscribe. And if you enjoy topics like today's, where conventional and functional medicine come together, please check out my book, The Clear Skin Diet: Unlocking the Secret Link Between Food Sensitivities and Skin Health. It's about how various foods can affect our skin health by changing our gut microbiome, immune system, and hormones. It's available on Amazon and Barnes & Noble. The link is in the description. Thank you very much for watching. Until next time, bye-bye.